When people reach their 60s, many parts of the body begin to change in subtle but important ways. Bones become more fragile, joints stiffer, muscles lose some mass, and perhaps less visible at first, but just as critical, are changes in cardiovascular and respiratory systems. The brain's blood vessels may be a little less elastic, blood pressure control may be less precise, sleep patterns change, and there may be other risk factors present like hypertension, atrial fibrillation, sleep apnea, diabetes, or vascular stiffness. One of the less obvious but emerging concerns among clinicians is how the way you sleep, your sleep position, can interact with these age-related vulnerabilities. Over time, researchers have found evidence that certain positions, particularly sleeping on the back, supine position, can exacerbate sleep-disordered breathing, worsen oxygen desaturation, and may indirectly elevate risk for stroke, especially in older people. What we know from research. 1. Supine sleep and obstructive sleep apnea, OSA. The supine position, that is, lie on the back, is well documented to worsen obstructive sleep apnea in many individuals. In supine position, gravity pulls the tongue and soft tissues backward, narrowing the airway. This causes more frequent collapses of the airway, more apneas, pauses in breathing, and hypopneas, partial obstruction, leading to intermittent drops in oxygen levels, surges in carbon dioxide, repeated arousals, and increased stress on the cardiovascular system. For older adults, OSA is particularly dangerous. It contributes to elevated blood pressure, disrupts nighttime dipping, normal lowering of blood pressure at night, increases oxidative stress and inflammation, and is a known risk factor for stroke. 2. Supine sleep in stroke patients. There are studies showing that patients who have had ischemic strokes tend to spend a large portion of their sleep time in the supine position. One study of acute stroke patients, median age 67, found that many slept almost entirely in supine during sleep monitoring. Although this doesn't necessarily prove that supine sleep caused their stroke, it suggests a relationship. Those who already have strokes tend to have worse sleep and more apneas while supine, which might worsen their condition or impede recovery. AHA Journals +1. 3. Sleep position and heart/brain health. The American Heart Association, AHA, has discussed the influence of sleep position on brain and heart health. For example, people with sleep apnea are much worse off when they sleep on their backs than when they sleep on their sides. Supine position often increases the severity of apnea, raising carbon dioxide, lowering oxygen, causing cardiovascular stress. These changes can lead, over time, to risk factors for stroke. 4. Sleep quality and relationships with stroke. Numerous studies show that poor sleep in general, whether from apnea, insomnia, irregular sleep duration, or fragmented sleep, is linked to higher incidence of cardiovascular disease and stroke. Moreover, in older adults, these risks tend to accumulate. Sleep duration that is too short or even too long, poor sleep quality, irregular sleep patterns. These are all shown to contribute to adverse outcomes. Why over 60 is a critical age. Aging brings physiological changes that amplify the effects of bad patterns, including sleep. Some of these are reduced vascular elasticity. Blood vessels are less flexible, so they don't respond as well to sudden changes in pressure or to small reductions in oxygen. A small insult becomes more impactful. Reduced respiratory reserve. The lungs and diaphragm have somewhat diminished efficiency, which makes airway obstruction during sleep more problematic. Presence of comorbidities. Hypertension, atrial fibrillation, type 2 diabetes, and other diseases are more common, all of which interact with sleep health. Diminished sleep architecture. Older adults tend to have less deep sleep, more fragmented sleep, more awakenings, and a higher chance of sleep disorders. A position that worsens breathing or reduces oxygen can thus create bigger problems. Case examples. To make this more concrete, here are some composite but realistic scenarios inspired by real patient reports and published literature. Case 1. Mr. Thomas, age 68. Mr. Thomas has had high blood pressure for 15 years, well controlled. He recently began snoring loudly, with occasional gasping for air at night. His wife observed pauses in his breathing. He usually falls asleep on his back. Over several months, he felt more tired during the day, had headaches in the morning, and his blood pressure readings in the evening were creeping up. After a sleep study, it was found that his apnea-hypopnea index, AHI, was worsened significantly when he was in supine position. The oxygen saturation dropped less than 88% multiple times overnight. He also had mild left hemispheric white matter changes on MRI scan, some small vessel disease. His doctor warned that the combination of sleep apnea, nighttime hypoxia, and supine sleep could increase his risk of stroke, particularly lacunar infarcts, small blockages in deeper brain vessels. He was advised to sleep on his side, use positional therapy, pillows, or a positional device that prevents rolling onto his back, lose some weight, and use CPAP, continuous positive airway pressure. Over 6 months, his sleep apnea severity decreased, his blood pressure improved, and neurological imaging showed no further worsening of small vessel disease. Case 2. Mrs. Rose, age 72. Mrs. Rose has had atrial fibrillation for several years, treated with medications. Because of her heart rhythm issue, she is already at elevated risk of stroke. She also has mild chronic obstructive pulmonary disease, COPD. She sleeps mostly flat on her back, as she finds side sleep uncomfortable due to arthritic shoulder pain. One night, she awoke gasping. Her oxygen saturation dropped significantly. She didn't do much because she thought, old age. Her cardiologist noticed that despite medication, she had more episodes of nocturnal hypertension and sometimes mild swelling of the ankles. She was referred to a sleep clinic, found to have moderate OSA with worse events when supine. Also, her nighttime oxygen dips were causing strain on her heart, triggering surges in sympathetic nervous system, stress response. Cumulative stress can make blood more likely to clot, increase inflammation, and compromise vascular endothelial lining. The doctor advised side sleeping, using wedge pillows to elevate the head, avoiding large meals before bed, and using oxygen therapy at night during periods of low II. Over time, her cardiac rhythm stabilized, her risk markers decreased, e.g. less nocturnal hypertension, fewer oxygen desaturations, and her stroke risk estimation dropped. Why supine back position is especially risky overnight. Putting together the clinical observations and research, here's why sleeping on your back, supine position, is often the risky position for older adults when considering stroke risk. 1. Worsening obstructive sleep apnea, OSA. As noted, in supine position the airway is more likely to collapse. This causes periodic breathing interruptions, oxygen desaturations, and micro-awakenings. Each apnea event causes surges in blood pressure, heart rate, stress hormones, like adrenaline. Over time, these repeated insults increase cardiovascular strain, can damage vessels, increase risk of clot formation, and raise stroke risk. 2. Impaired oxygen supply to the brain. When breathing is interrupted during sleep, less oxygen reaches the brain. If these disruptions are frequent and severe, they may contribute to neuronal stress or injury, possibly affecting brain tissue over time. These effects accumulate with age. 3. Higher blood pressure and loss of nocturnal dipping. Normally, during deep sleep, blood pressure dips. This is protective. But if sleep is interrupted, fragmented, or oxygen levels drop, as in supine sleep with apneas, that dipping is blunted or lost. Higher overnight blood pressure means more stress on arteries, especially those in the brain. 4. Increased risk of clotting and vascular inflammation. Periods of low oxygen, hypoxia, trigger inflammatory pathways, oxidative stress, and increase the tendency for blood to clot. Old blood vessels already have more wear and tear, mitoplaques, and may be more rigid. These factors combined increase stroke risk. 5. Comorbid interactions. If someone also has hypertension, diabetes, heart rhythm disorders, e.g. atrial fibrillation, or prior small vessel disease, these combine with the stress from poor breathing or oxygen fluctuations to increase risk much more. Thus, what might be safely tolerated in younger age becomes significant risk after 60. Underscore 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 underscore. What the doctors explain, guidelines and prevention. Doctors, especially those specializing in sleep medicine, cardiology, neurology, and geriatrics, explain to older patients certain sleep posture modifications, plus other supportive lifestyle changes, to reduce stroke risk. Here's what they commonly advise. Avoid sleeping flat on the back, supine, especially overnight. Instead, sleep on the sides, left or right. Side sleeping tends to keep the airway more open, reduce the gravity effect on soft tissues in the throat, reduce apneas, help maintain oxygen levels through the night. Use positional therapy. This can include devices or pillows that prevent rolling onto back, or a wedge pillow that elevates the upper body a bit. Sometimes even sewing a tennis ball into the back of a shirt used to sleep can discourage back sleeping, though this is more old school. Elevate head of bed slightly. Raising the head by a few inches helps reduce airway obstruction and reflux, which can contribute to disrupted breathing. Diagnose and treat sleep disorder breathing. If symptoms like loud snoring, daytime sleepiness, morning headaches, observed pauses in breathing are present, a sleep study may be warranted. Treatment options include CPAP, mouth devices, lifestyle weight loss, etc. Manage comorbidities aggressively. Good control of blood pressure, rhythm disorders, diabetes, cholesterol. Because these already contribute to stroke risk, reducing one's burden helps. Sleep hygiene and consistency. Going to bed at similar times, ensuring enough sleep, usually 7 to 8 hours, but individual variation matters. Avoiding alcohol or sedatives close to bedtime. Avoiding heavy meals, caffeine, and screens late at night. Underscore. What we don't know yet / uncertainties. The research is still emerging on exactly how much risk is increased solely by back sleeping in people over 60, independent of OSA or other illnesses. In many studies, being supine exacerbates OSA, and OSA is a risk, but whether back sleeping alone in someone without OSA is a big risk is less clear. There is variation in people's anatomy. Some people sleep on their backs all the time and never have breathing problems or stroke. Others have severe sleep apnea in any position. It depends on weight, neck size, airway anatomy, overall health. The optimal angle of elevation, or how much head elevation helps, is still not fully standardized. Also, some older people have arthritis, pain, or orthopedic issues preventing comfortable side sleeping. Mrs. Gloria's awakening. Mrs. Gloria is 65, recently retired librarian. She has controlled hypertension and mild obesity. She's always been a back sleeper, ever since she was a child. She started noticing she felt foggier in the mornings, had swelling in her legs, occasional headaches, and her blood pressure that used to dip overnight no longer dipped much. Her doctor attributed some things to age, but something didn't feel right. One evening, she fell asleep on her back, as usual after a heavy late dinner and some wine. In the middle of the night, she was awakened by gasping and a choking feeling. She didn't think much of it, but the next morning, her head ache was worse, blood pressure much higher than usual. Over the next few weeks, she had more mornings like that and began to feel tired, short of breath upon light exertion. Her daughter recorded a short video of her sleeping and noticed her mouth opening wide, snoring very loudly. Mrs. Gloria's sleep specialist recommended a sleep study. The results showed significant obstructive sleep apnea, with oxygen levels dropping several times per hour, especially when she was on her back. Imaging showed small white matter changes in her brain consistent with small vessel disease, which often precedes stroke. Her 24-hour blood pressure monitor showed loss of nighttime dipping. Her stroke risk score, using established risk calculators, was elevated. Her doctor recommended she try side sleeping, use a wedge pillow to elevate her upper body, get a CPAP machine, lose a modest amount of weight, avoid alcohol near bedtime, and improve sleep hygiene. Over months, she saw improvement. Less morning headache, more restful sleep, lower average blood pressure. Her oxygen levels overnight more stable. Preventive MRI after a year showed no progression of white matter disease. Practical advice and do's and don'ts. Here is what older viewers, 60 plus, can do to reduce sleep position-related risk. Do. Sleep on your side, left or R. Use pillows to prevent rolling onto your back. Body pillow, wedge pillow. Slightly elevate the head of the bed 4 to 6 inches to reduce gravitational collapse of airway. Get evaluated if you snore loudly, have gasping during sleep, daytime sleepiness, morning headaches, or wake up feeling unrefreshed. Control blood pressure well. Manage heart rhythm issues, e.g. atrial fibrillation, diabetes, obesity. Maintain good sleep habits. Consistent bedtime. Avoid alcohol or sedatives close to bedtime. Avoid heavy meals late at night. Get enough sleep, neither too little, e.g. less than 6 hours often, nor excessive, more than 9 hours regularly, because both extremes are linked to cardiovascular risk site, rather than flat on your back. Don't sleep flat on your back all night, especially if you have risk factors like high blood pressure, obesity, snoring, or known sleep apnea. Don't ignore signs like gasping for air, choking episodes, daytime sleepiness, or morning headaches. Don't use heavy pillows or bedding that force your head forward or block breathing. Don't neglect regular health checkups for heart, lung, and sleep health. Why this is important and what viewers need to know. Many older adults consider sleep position to be a matter of comfort only, not a health issue. But recent research and clinical experience show that sleeping posture does matter, especially once you have risk factors or underlying predisposition. Stroke is a leading cause of disability and death, and often strikes without warning. Risk factors we can modify, like sleep position, treated sleep apnea, good blood pressure control, are especially valuable in prevention. This is practical, low cost, and in many cases no more than a change of habit, plus possibly supports like pillows or CPAP, that can make a tangible difference in health. Viewers over 60 should pay attention not just to what they eat or how much they exercise, but how they sleep. It can be one of those overlooked but powerful components of health. After 60, lying flat on your back while you sleep can quietly worsen breathing issues, reduce oxygen delivery to the brain, disturb blood pressure control overnight, and amplify risk factors for stroke. Doctors increasingly believe that side sleeping, head elevation, and attention to sleep apnea can protect the aging brain and arteries. If you snore, wake up gasping, or feel less rested, even if you think you sleep just fine, it's worth having your sleep evaluated and making small changes now, rather than waiting until the risk becomes costly.